Hey everyone, welcome to the channel Mr. Teeth, where you get dental concepts simplified and dissected in easy way. Whether you are a BDS student trying to get your basics strong and also preparing for your board exam, so this video will be very helpful for you during your preparation days for your board exams and also for clearing your basic concepts regarding dentistry and in this dental anatomy subject. Similarly, someone who is preparing for the competitive and licensing exam, this video is definitely going to help you. As we know that dental anatomy is one of the fundamental subjects in the dentistry and forms the base for the clinical practice. So let's dive into it and in the most interesting way possible. So as you have seen in the video, uh, the today's topic is our introduction to the dental anatomy. So in this topic, this is the starting topic, first topic of the oral anatomy. So I have covered almost all the things that are present in this chapter into these 7 subheadings or the topics, subtopics. So there are total 10 topics, and those 10 topics I will be delivering in videos, in 2 videos, sorry. Okay, I will be delivering in 2 videos. So in first video I will be covering with the first 7 topics, and after that I will be covering with the last 3 topics. Okay, so in first 7 topics there are defining the dental anatomy, types of the teeth, dental formula, parts and the components of the tooth, surfaces of the tooth, types of the dentition, and tooth numbering system. Similarly, in another part I will be dealing with the divisions into the thirds of the tooth. Okay, divisions into the thirds of tooth. Similarly, line angles and the point angles and important landmarks. Okay, so from this topic, introduction to the dental anatomy, I think every subtopics are extremely useful when you will be looking at further videos on dental anatomy, and also during when you study the textbook of dental anatomy or you study dental anatomy from anywhere. These are the foundation to the dental anatomy, so you guys have to be clear that every topics in this module is very important to understand the dental anatomy in further days. So without delaying much, I want to start I want to start this chapter. Okay, so let's dive into it. So let's start our topic with the definition of the dental anatomy. So let's start with the simple definition that dental anatomy is the study of the teeth and their associated structures. Okay, and its associated structures. Okay, but it is not much simple. Okay, to study, to say like that in such a way. According to the Wheeler's books of the dental anatomy, it says dental anatomy, dental anatomy is not only the study of the development, morphology, function, and identity of each of the teeth in human dentition, but also includes the way in which teeth relates. This term in this definition is very important. Okay, so in which the teeth relates in the shape, form, structure, color, and function to other teeth in the same dental arch or in the tooth in opposing dental arch. So simply here the definition wants to tell us that it is not simply to study, not simply dental anatomy means to study the development, morphology, function, and identity of the teeth, but also we study here the relationship between the one teeth with the another teeth. So we can say that our tooth is quite similar with us, okay, because we have our own personality and social relationship, so do our teeth also have, okay. So many of us may feel that this subject is easy during our dental school's day. Yes, it's true, but taking it lightly may be harmful. This subject is foundation to all our other subjects in the dentistry. So take it easy, but also work hard and smartly. Okay. So all right. Now move. So our another topic is type of the teeth. In type of the teeth, we know that there are primarily four main types of the teeth. They are incisors, canine, premolars, and the molars. Okay. So the incisor, the designation for the incisor becomes I. The designation for the canines becomes C, premolars become P, and the molars become M. Okay, so in this, according to the position of the teeth, incisors and canines are under the anterior teeth, and premolars and molars are under the group of posterior teeth. So anterior teeth are mostly used for tearing and biting. Similarly, the posterior teeth, premolars and molars are used for the grinding of food. Okay, and now, so it is a simple topic. I think I shouldn't have to give much more effort in this part of the video. Now let's move to the another subtopic, that is called dental formula. In the dental formula, simply we can say that dental formula is a shorthand representation of the number and the types of the teeth. Okay, it is a formula of a side. Okay, it is a formula of a side of both the dental hearts. Okay, there are three major components. Okay, there are three major components. They are denomination means denominating or designating the teeth, as we designated incisor as a I, canines as a C, molars as a M, and premolars as a P. Similarly, a horizontal line to separate the maxillary and mandibular arches, and the number for the tooth count. Okay, now here we can see I have mentioned the dental formula of the deciduous dentition, that is I 2 by 2, C 1 by 1, M 2 by 2. Okay, simply we can remember it by 2 and 2. Okay, the sum of 2 plus 1 plus 2 is 5. It means that there are 5 tooth in each quadrant of the primary dentition or deciduous dentition. So totally there will be 10 tooth in each dental arch. Similarly, in the secondary dentition, I have written here primary. Sorry for the mistake. Secondary dentition. Okay, now secondary dentition, the dental formula is I 2 by 2, C 1 by 1, P 2 by 2, M 3 by 3. That means it is 16. The sum of 2 plus 1 plus 2 plus 3, that is our 8, and 8 into 2 is 16. So there are 16 tooth in each dental arch in a permanent or secondary dentition. Okay, sorry again, I did mistake. So here is permanent. Lot more mistakes are being done nowadays. Okay, so similarly, let's move to our next topic, that is parts and the components of the tooth. Okay, so in the parts and the components of the tooth, each tooth, it is divided into the crown, neck, and the root. Okay, so crown is that portion of the tooth that is normally visible. Okay, simply in a layman tongue we tell that crown is that portion of the tooth that is visible from our eyes in oral cavity. Similarly, the neck or the cervical region. Okay, it is junction between the crown and the root. Similarly, the third part is the root, that is under the gum inside the socket. Alveolar bone gets attached to the root by the periodontal ligament. We will be discussing those thing in the oral histology portion of our video tutorials. So in this I want to focus on one point, is that Crown is divided into the anatomical crown and the clinical crown. An anatomical crown is that part of the tooth which is covered by the enamel. Okay, that is covered by the enamel. Simply, we tell that it is covered by the enamel whether it is visible or not visible. That is not a matter of context here. But only we say is that it should be covered by the enamel. That portion of the tooth that is covered by the enamel is anatomical crown. Okay, and the extension for the anatomical crown is from the incisal edge in anterior teeth and occlusal surface in posterior teeth. Okay, so incisal edge or occlusal surface to the cemento-enamel junction. Cemento-enamel junction is the junction between the cementum, as we know. If this is teeth, okay, if this is a rough diagram of a teeth, and here is a this is CEJ. Okay, so this is cemento-enamel junction. As we know that in the outermost portion of the root there is cementum. Similarly, in the outermost portion of the crown there is enamel. So the junction between the enamel and the cementum is called cemento-enamel junction. It's simple to understand. Similarly, as there is anatomical crown, there is also anatomical root. I will discuss that by showing one picture. Okay. Now let's discuss clinical crown. So clinical crown is that part of the tooth which is visible in oral cavity. So it is concerned with the visibility. It means simply that it should be visible in oral cavity. Whether it is covered by enamel or cementum, it must be visible in the oral cavity. Okay. So here, as I have mentioned, anatomical crown is smaller than the clinical crown. It is a pathological condition in which it is a pathological condition that is caused due to the recession of the gingiva. Or also sometimes in a super erupted tooth. Similarly, as you guys can wonder that we know that anatomical crown is greater than clinical crown, but also in this scenario, when the tooth is not fully erupted, in such case anatomical crown is much more greater than the clinical crown. Okay, normally also anatomical crown is greater than clinical crown, but in the case of not fully erupted tooth, that means tooth is not fully erupted, in those tooth there is a much larger anatomical crown than the clinical crown, as the teeth is almost in the gums, only some portion of the teeth is erupted. So now, after the completion of this, I want to show you one pictures discussing this part and this part. So the picture is, I will take some few minutes. Okay, so I want to show you here. Is it visible? Okay, yes, it is visible. Now just we can see here that okay, so here we can see that this is a cemento-enamel junction between the enamel and the cementum. Okay, so the portion of the tooth that is above the cemento-enamel junction is anatomical crown. Similarly, the portion of the tooth that is below the cemento-enamel junction is the anatomical root. Okay, similarly, clinical crown means the portion of the tooth that is above the gingiva. Okay, it means that when it will be above the gingiva, it means it will be visible by our eyes. Okay, so this all portion is the clinical crown. Similarly, that portion of the tooth that is under the gingiva, that is not visible, is called the clinical root. And this condition arises when there is recession of the gingiva. If there is recession of the gingiva, there is greater clinical crown. Similarly, in another photo, I want to show you that here is a anatomical crown and here is an anatomical root. In this picture, they wanted to show you that it is a not fully erupted tooth. So anatomical crown is here as size as that of anatomical crown and anatomical rate are always almost constant, but the clinical crown, here we can see that it is the distance from the cusp tip to the gums lining the tooth crown. So here we can see clinical crown is smaller than the anatomical crown and the clinical root is larger. Okay, so simply after showing these two pictures, I wanted you guys to know that uh, anatomical crown and the clinical crown, they both are constant. Okay, it means that they do not change their length with the eruption or recession of the gingiva, but clinical crown and the clinical root, they are changing their distance, sorry, they are changing their length with the conditions. As like in a recession of gingiva, there is greater clinical crown and lesser anatomical, there is greater clinical crown, and similarly in not fully erupted tooth, there is lesser clinical crown. Okay, so let it be now. All right, now I think you guys have understood well. Now let's move to another subtopic under this heading, that is components of the tooth. Normally components, in component portion we have normally three major components of the tooth. They are enamel, dentin and the pulp. Okay, so dentin also further two types. Okay, uh, in enamel, in oral histology subject we will be discussing further more about the dentin. uh, there are many types of dentin, as you have studied or not. There are mental dentin, circumpulpal dentin. So this classification, that is coronal dentin and radicular dentin, is on the basis of its position. Means coronal dentin is that portion of the dentin that is present in the crown. Similarly, the radicular dentin is that portion of the dentin that is present in the root. Similarly, here in the pulp also we can see here that I have written pulp chamber and the pulp horn. So these both components are the, they both are the component of they both are the component of the pulp in the crown itself. Okay, so pulp chamber and the pulp horn, I will show them in picture. Similarly, radicular pulp or pulp canal is that portion of the pulp that is present in a root of the tooth. Okay, so let's understand it by one picture. So as we can see here, I have taken this picture from the wheelers. Okay, so this is a cross section of our anterior teeth, and we can see here. Okay, so we can see here this is a enamel, sorry, so this is enamel. Okay, this white color portion is enamel. Similarly, this golden yellow color portion is dentin, and this red color portion like canal, which is a pulp. Okay, so here pulp are giving the accessory canal. We will be discussing with this in histology portion. Similarly, this is gingiva, this is alveolar bone, this dark golden yellow color substance is a cementum. This figure is very important. I think I will keep this photo, this slide in Instagram post, so from there you can uh, see this. Also in a book it is given nicely, so you can go through that too. In posterior teeth we can see here that have pulp is bifurcated, as the root of the tooth is also bifurcated. So in crown portion of the tooth we can see this is a pulp chamber. Okay, and it is giving to the root, it is giving two roots, that is pulp horns, that is directed towards the cusp. Okay, and in primary tooth these pulp horns are more prominent, okay, than the permanent tooth, that we will be discussing in another video, in further videos. Okay, pulp horns are more prominent in the primary tooth, and that have some clinical importance, we will discuss there itself. And here Also we can see here pulp canal or radicular pulp, we can say, that is directed towards the apical portion of the root. Okay, so this must to show here from here. So now we will move towards the another topic, that is surface of the tooth. Okay, so in surface of the tooth, we can see here, first of all we will discuss, normally there are five surfaces in posterior teeth and four surfaces in anterior teeth plus one ridge. Okay, in primary teeth. So five in a permanent posterior teeth and four plus one in a anterior teeth. I think I have written this in note also. Okay, oh, so here is it is. Okay, so anterior teeth, it is a four surfaces, it have four surfaces and one ridge. Similarly in posterior teeth, it have five surfaces. Okay, so what are the four surfaces of the anterior teeth? So anterior teeth contain the four surfaces, that is a facial and mesial, distal and the lingual or palatal. Similarly in a posterior teeth, the addition of occlusal surface is there, so it becomes the five. So all right, let's discuss about the facial or buccal or labial surface. Okay, so facial is a collective term that is generally referring to the surface which is nearest to the face, that may be buccal or labial. Buccal means that surface of the tooth that is closer to the buccinator muscle of the cheek. It is the context of a common sense that buccal means that portion. Buccal means facing towards the buccinator muscle. So the tooth must be posterior teeth. Okay, being anterior teeth, it can't face to the buccinator muscle. So posterior teeth are only those teeth that can face to the buccinator muscle. So this tooth are present point I have written, that is their labial means facing the lips, so it must be present in the anterior teeth. It's simple to understand. Okay, so now in another part on the surface, we are looking here palatal surface. Now palatal surface means it should be near to the palate, and in palate, okay, it should be near to the palate, and near to the palate, palatal surface, it should be near to the palate, and palatal surface. Okay, so as we know that palate is present in a maxillary, okay, in upper portion. So palatal surface must be present in a maxillary teeth, and lingual surface near to the tongue, so it must be present in the mandibular teeth. Similarly mesial surface and distal surface. So I want to clear one thing here, that many of the students who didn't know what is a proximal surface. Okay, proximal surface is collectively the proximal surface and okay, so proximal surface is collectively a mesial surface and the distal surface. So a mesial surface is that surface of the tooth that is closest or facing towards the midline. Similarly distal surface is that surface of the tooth that is facing away from the midline. Okay, so proximal surface is the surface between the two tooth. Okay, that may be mesial surface of that tooth or distal surface of the another tooth. Similarly now here I have written incisal surface, but the proper term will be incisal ridge. Okay, incisal ridge is a proper term, as there is no surface in the anterior teeth, so incisal ridge will be the proper term here. So incisal ridge is the upper portion, okay, cuspal incisal portion of the anterior teeth. Similarly the occlusal surface, there is upper portion of the posterior teeth. It is simple to understand it. Okay, so the surfaces are covered. Now let's move to the another part, that is types of the dentition. Okay, so in types of the dentition, we can see here that primarily there are two sets of the dentition. One is a primary dentition, another is a permanent dentition. So primary dentition, the time of eruption is from 6 months. Okay, baby when born, after after the birth of the baby to the 6th month. Okay, after 6 months of the baby's birth to the 3 years of, okay, age of the baby, there is eruption of the primary dentition. Similarly it is exfoliated by the 13 years. Okay, similarly permanent dentition, the eruption time is 6 years to the 25 years. Okay, so these I think they are important for the MCQ purpose. Okay, so the guys who are preparing for the competitive exams. So these questions are, I think, important for them. Similarly, exfoliated, they normally stays in oral cavity for the longer time, and some people who have poor oral health and poor oral hygiene, they this tooth get exfoliated before their death. But who do have healthy gums and healthy oral health, it stays up to the death, it stays till the death. Okay, so I want to tell here now another thing is that mixed dentition phase. Okay, so mixed dentition phase is that phase that constitute both primary dentition as well as the permanent dentition. As we can see here, it is erupted up to 3 years, and till 13 years it is present in oral cavity. But here it is erupted in 6 years itself, but 6 year itself. So uh, there must be presence of both the primary and permanent dentition in oral cavity. So that period is called mixed dentition phase, and that is from 6 years to the 12 years. Okay, now in primary dentition, there is absence of the premolar. Simply, it contains the central incisor, lateral incisor, canine, first molar and the second molar, that constitute 20 teeth. Similarly, in the permanent dentition, it constitutes of the 32 teeth that constitute of the central incisor, lateral incisor, canine, first and second premolar, first, second, and third molars. Okay, now these points are clear. In primary dentitions, first and second premolars are replaced by the first and second molars in a permanent dentition. Okay, this is also easy to understand. So let's discuss about tooth numbering system now. Okay, so we have three system, that is universal notation system, Zygmundi Palmer notation system, and FDI system. Okay, so FDI system is the uh, most accepted nomenclature system of the tooth. Now first of all we will discuss about the universal notation system. So in primary dentition, how the universal notation system used is in the alphabetical form. Means that we use alphabetical terms to designate the primary dentition tooth. As we can see here in the figure, we start from the right second molar to the left second molar. Okay, in the maxillary teeth by A to J, alphabetical terms, alphabetical letters. Similarly, in the mandibular teeth, it begins at the left second mandibular molar to the right second molar, from K to T, as we can see here. Okay, and this is going this side and this is going this side. Also, I want to clear that many of the people may face problem that which is the number one quadrant and which is the another second, third number quadrant or fourth number quadrant. So I want to clear them that right maxillary quadrant is a first quadrant. Similarly, left maxillary quadrant is a second quadrant. Similarly, the left mandibular quadrant is a third quadrant, and the right mandibular quadrant is a fourth quadrant. So it goes in this pattern. Okay, similarly, now we go in the permanent dentition. So the thing that we should remember here is that we use the numbers in numerical values, or numbers are used in this dentition. We have 1 to 16 designated for the maxillary teeth from the right third molar to the left third molar. Similarly, in the mandibular teeth, from the left third molar to the right third molar, we designate by 17 to 32. Okay, it is simple to understand. As we can see here in the figure, this is a mid-sagittal plane. Okay, we are starting with the right third molar. Okay, in the first quadrant, in the right maxillary quadrant, okay. So we are starting from 1 and we are reaching 16 in the each arch, and again going down in a mandibular arch and starting from 17 and reaching to the 32. Okay, so it is simple to understand. Just remember that in primary dentition we use alphabets, and in permanent dentition we use numbers. Okay, and I have mentioned here. Okay, now in Zygmundi Palmer system, okay, in Zygmundi Palmer notation system, here we can see in this system quadrant are extremely uh, important to be drawn, because in absence of quadrant we can't say that this is lateral incisor of maxillary arch or central incisor of the maxillary or mandibular arch or any arch. Okay, so here quadrant is must to be drawn. And also the thing here also that is similar with the universal notation system is that in primary dentition we use alphabet and in permanent dentition we use number. So as we can see in the figure, as I have drawn quadrant and I have written serially A B C D E. So here maxillary right central incisor is designated by the A, but drawing like a quadrant. Okay, so it is designated in this symbol. Okay, so it is very important to know that many of us don't know this and make mistake. Only just we write A, and which A we don't know. It may be left central incisor, right central incisor, lower central incisor. Okay, so similarly here designation for the left mandibular central incisor is this. Okay, left. Okay, left. Oh sorry, I have written here mistake. This is not here. Okay, so this as a left mandibular central incisor is this. So left mandibular central incisor designation should be like this. Okay, similarly in a permanent dentition we use number. Okay, so similar to the primary dentition only, but only we use numbers. Now one note is for you all that universal notation system is acceptable to the computer. Okay, it is acceptable to the computer language. Also less confusion is present due to the separate designation, but not in a palmar notation system, as we have to draw quadrant for the proper designation of the any tooth in a dental arch. Now the most important nomenclature system is FDI system, and the full form of FDI is Federation Dentire International. It is a system of the two digit. Okay, it is a two digit system that is widely accepted system. Okay, and the first digit it represents the quadrant, and in second digit it represents the tooth number. So in quadrant, first digit it represents the quadrant. So the things that we should remember here is that in primary dentition and the permanent dentition, what are the differences? So in primary dentition the quadrants are designated by the 5, 6, 7 and 8, and it goes in a way that it starts from the first quadrant, then second quadrant, and then third quadrant, and then the fourth quadrant. Okay, so in this pattern it goes. So this is 5, this is 6, this is 7, and this is 8. Similarly for the permanent. Okay, as I can draw here 1, again 2, again 3, and again here 4. Okay, so this is for the quadrant number. Okay, for which quadrant it is. Similarly the tooth numbering system, second digit represents the tooth number system. Second digit it represents the tooth number system. Now that is a primary, it starts from the 1 to the 5, and in permanent it starts from the 1 to the 8. Okay, so I have drawn here in the figure. We can see here that it is a after looking the first digit we can say that it is a numbering system of the primary dentition. So this 5-1 means it is a right primary maxillary central incisor. Okay, right primary maxillary central incisor. Okay, similarly in 7-1 we can say that it is a left mandibular primary central incisor. Okay, so it is a primary dentition. First digit for the quadrant and second digit for the tooth numeric system. Okay, and in the permanent dentition we can see here that in upper and here I have written lower. So this is similar to this, but only the tooth number is different here. So okay, so I have completed all the parts of this video, but also I will do short revision of all those part in just 2 minutes. Okay, 2 minutes, 5 minutes, let's see. So I have defined the dental anatomy, so it should be learned by yourself. Similarly, types of the teeth, we all know this dental formula. It have three major components: denomination, horizontal line, and the number. Similarly, it represents the side of the tooth, not a quadrant of a dental arch. Okay, similarly 2 and 2, here 2 and 2 3. Okay, so now another part is crown, neck, and root. Okay, crown, neck, and root are the parts of the tooth. We have anatomical crown, and another we have clinical crown. Anatomical crown are the that part of the crown covered by the enamel, and clinical crown visible in oral cavity. In recession of the gingiva, there is clinical crown greater than anatomical crown, and not fully erupted tooth, there is anatomical crown is more and greater than clinical crown. In components, there are basically three components: enamel dentin and pulp. In dentin, we have coronal dentin and radicular dentin. Crown, it is present in crown, it is present in dentin, in a root, sorry. In pulp, we have pulp chamber and pulp horn, and in radicular dentin, we have in a radicular dentin or pulp canal. Okay, so now we can see here the surfaces of the tooth. We have facial, either buccal surface or labial surface. Buccal surface, buccinator muscle; labial surface facing the lips. Okay, now in palatal surface we can see here, or lingual surface we can see that it is near to the palate, it is near to the lung, so it must be in maxillary teeth, it must be in a mandibular teeth. Mesial surface and the distal surface, these are both the portion of the proximal surface. Proximal surface means the surface that is between the two tooth. Either they must be mesial surface of one tooth and distal surface of the another tooth. Now incisal surface or ridge, this is present in a anterior teeth, and occlusal surface is upper portion of the posterior teeth that is present in a posterior teeth. Okay, so anterior teeth there are four surfaces and one ridge. Similarly, in a posterior teeth we have five surfaces. Okay, and one occlusal surface is present in a ridge form in anterior teeth. Types of the dentition, we have primary dentition and permanent dentition, eruption, exfoliation. So this is a most important data that is to be remembered for the competitive exam. 6 months to 3 years eruption time, exfoliated for 13 years, 6 years to 25 years, stays in oral cavity for the long time. Mixed dentition period, it lasts for 60 years to the 12 years, and primary dentition 20 teeth, permanent dentition 32 teeth. Similarly, in tooth numbering system, just remember this figure as I have mentioned here. So in primary dentition we use alphabet A B C D E F G H I J, A to J in upper arch, K to T in lower arch. Similarly, in permanent dentition we use 1 to 16 in upper arch and 17 to 32 in lower arch. Okay, so Zygmunti and palmar rotation system, here we require the quadrant. So designation would be like this: A, and designation lower mandibular center should be this. Okay, so ABCD alphabets for the primary and number for the permanent. Okay, so it's completed now. Now here we can see here two digit system, widely accepted system, that is primary and permanent: 1 2 3 4 5 6 7 8. Okay, so 5 6 7 8 for the primary and 1 2 3 4 for the permanent. Okay, so first digit for the quadrant, and I have written here clearly, so it's simple to understand. I think I have missed this portion, and this portion means that it is important. Okay, so some teachers may ask in viva that permanent upper right central incisor, okay, designate it by the FDA system. So when you tell 11, it is wrong. It is not 11. Okay, it is 1 1. You should pronounce 1 1 always, because it is 2G system. You should pronounce 1 1. Don't pronounce 11. Okay, that is going to be wrong. So this type of question can be asked in MCQ. Okay, MCQ. So that's it is for the part 1 for the introduction to the dental anatomy. And I want to tell you guys that while reading the dental anatomy, always use the flowchart. Okay, always use the flowchart, mnemonics, and self-drawn diagrams. That makes easier to remember for the longer time. Similarly, keep revising in a short intervals, as I have done revision of all those uh, all those notes in just 2 to 3 minutes.